Okay, good morning. My name is Cheryl Donald. I am with HRSA's Region 2, Office of Regional Operations in New York City, and I want to bring you greetings on behalf of our multi-optive team, who is led by OASH. So as you can see, our team comprises representatives from OASH, HRSA, ACF, SAMHSA, ASTHO, which is the Association for State and Territorial Health Officials, as well as the CDC. So a little bit of background on our project. In March of 2015, the DHS Region 2 executive staff traveled to the U.S. Virgin Islands, which is one of the jurisdictions of Region 2, to meet with Governor Mapp and the territorial health officials. Governor Mapp has requested our assistance from DHS Region 2 with their efforts to improve the management and tracking of their federal grants that they receive within the territory from HHS. So the problem here is that territorial health officials are not spending the total amount of federal funding that's being awarded to the territory from DHHS. This graph is an example of CDC funding that has gone into the territory between fiscal year 2010 and fiscal year 14. You all may not be able to see, but 61% and 21% respectively of funds were not drawn down by the territory over this 5-year period. This is money that was unspent and lost to the territory. So looking at the problem, we look at a loss of human capital. So we're looking at the retirement of moving off island of federal government, territorial government health officials. We're also looking at a decreased capacity to identify and apply for federal support due to that loss of institutional knowledge. And then we're also seeing difficulty meeting the requirements of the federal support that the territory is currently receiving by the territorial health and human services staff. So during our time, we interviewed 30 stakeholders throughout the territory, as well as federal officials and state territorial officials. And some of the quotes that we heard from them is that we do not have a systems for grants management and monitoring, and we need a policy and procedure manual. Additional insights that we gleaned was there is a loss of human capital and infrastructure that continues. There's a lack of an appropriate grants management oversight process across the DHS grants awarded to the territory. And there's a realization that there's a low-tech solution that could work to help support the territory's efforts. So our potential solution here is the creation of a user-friendly grants management tracking system with 3 main functions. Number 1, to provide an overview of the HHS grants that are awarded. Number 2, to provide fiscal tracking of the grant drawdowns. And number 3, to identify key deadlines and dates that are associated with each of the individual grants. This is an example of our prototype. This is function 1, which would give you the overview of each one of the grants. And again, what is our end goal? Our end goal is a public health and human services grants management tracking system that is efficient and effective. Our key metrics will look at an increase in the percentage of federal funding spent per grant over the next fiscal year. At least 50% of the program directors, project directors, and staff will have utilized this tool, and there will be a decrease in the number of grants that are put on grant funding restriction. So our next steps are beta testing of the prototype, making revisions to the tool based on the assessment, and continuing to engage in agency leadership, staff, and the Office of the Governor on grants management issues in the United States Virgin Islands. Thank you.